Hello, this is Dr. Lee Hildebrand with the Thrive YouTube channel. And today I'm looking to talk about something that has become really prevalent in our lives as a completely new frontier, and that is AI. And specifically, I want to talk today about some of the trends in regard to AI and its use in mental health. There are some people that are interacting with bots where they can talk to a bot, which just kind of mirrors what they're saying in conversation. Kind of similar when you kind of get into a dialogue with ChatGPT or other types of forums. So, what I'd like to do is take a look at some of the concerns that are out there in regard to the use of AI in mental health and some of the aspects of real and true therapists and psychologists that can be superior and will continue to be superior. So, one of the challenges with AI is although AI can mimic conversation, it can't actually feel or care or have compassion for people the way a genuine and real person can. So, that's a real concern that people would have. And if you're in crisis or you're just really trying to express situations that are important to you, an AI bot is not going to be able to connect with you on a human to human level. This is something that is so important in our humanity, in our world, to be able to connect one to another. A second concern is that one may receive harmful or risky advice from AI. And AI can misunderstand context or nuance. Human communications are very nuanced in regard to what we're trying to say. So that definitely can be a concern as well. And quite frankly, it could even be dangerous if AI bots misinterpreted something and gave advice that could be dangerous for the individual. So as we all know, our mental health is complex and communication is complex. And we want to have accuracy in regard to the nuances, for sure. Another concern is privacy and really our data security. Many of these AI-powered apps collect really sensitive and personal information, and we just don't know how that could potentially be used. If there were potential leaks, or if there were situations where your information was to get out. And when you're talking to somebody from a counseling standpoint, you're looking for confidentiality and privacy in regard to the details of your life. Now, fourth concern is that in doing so, this can become really an over-reliance on technology may occur. People that are looking to substitute real and genuine therapy with trained professional humans, if they're interacting with AI, this can delay true treatment and also treatment for very serious situations that can develop. For instance, severe situations like suicidality or severe trauma. There's incredible nuance and incredible sensitivity that's required in these situations. And AI is just simply unequipped to handle this in emergencies. A fifth concern would be bias in really inequality. AI models have biases in regard to the data that they have, that they're programmed with. And this could really lead to inaccurate assessments with people, misinterpretations of data, and the inability to really ferret out and understand diverse cultural or linguistic or socioeconomic backgrounds that people are bringing to bear. And another concern is just really this erosion of human connection. We have already become so disjointed from one another through distancing, through social media, through predominant communications, through texting and messaging, and especially our young people, the kids and children and teenagers are not learning to carry on true and genuine interactions with other people. They're becoming isolated and really disconnected from humanity in these situations. So although AI can be a very powerful tool in a lot of areas, and we're all trying to seek ways that we can take advantage of the pros of AI, we still need to have adequate concern about the limitations. And why is real therapy better? Well, the first thing I would say for sure is what I spoke to earlier, is just human empathy and intuition. Therapists and counselors and psychologists like myself, we're going to bring real human experience in addition to our training. We've lived life. I have lived many years of life and have understanding about many situations, not only personally, but also through the hundreds and hundreds of people that I've interacted and come alongside and helped. And so there's going to be a highly trained ability that a real human being can have to read subtle cues and tone and body language. And the other aspect of this is we're able to adapt in real time. Secondly, we are trained with accountability and ethics. We follow professional ethical standards and codes that are there to help protect our clients in regard to their sharing of personal information, in regard to their mental health. There's a very strong accountability that go with our licenses. That is a very important aspect of counseling and therapy. In addition, I think real therapists are better because we can invoke complex problem solving. We have the ability to integrate family dynamics, culture, to understand a person's history and how that plays into the current circumstances, and really to bring personal values to that. We can understand and handle contradictions or even seeming contradictions in terms of human nature in some of the gray areas, the way algorithms in AI just are not equipped to handle. Another important benefit is crisis intervention. A therapist, a psychologist can respond with urgency and compassion. We're able to triage very quickly to understand the salience of a situation and what kind of help could be needed in very complex situations. And AI simply lacks the judgment and the resources to handle these kinds of concerns. And then lastly, I think much of the power of therapy is the therapeutic relationship. There is a bond that can be developed in a therapeutic relationship that is very powerful, can be very close. And there's a lot of trust and safety that's involved in that. And quite frankly, an AI algorithm is not able to provide that kind of safety and trust. Really the important emphasis here is that healing does not just come from specific techniques, but it comes from a connection one human being to another. So I wanted to address this topic and really to say I'm not being overly critical of AI here. I think there's a lot of very important uses. There are certain apps and aspects of AI that can help us give cues in regard to our health and mental health. And it can be a supplement to assist with this kind of access. But I would say this, that AI cannot replace human presence. It cannot replace accountability. It cannot replace the ability for a human to see the nuances in our situations and our lives. And AI cannot bring deep empathy. And this is what real therapy can be provided in terms of trained and seasoned professionals to be able to bring this. So I'm so glad that you tuned in. I hope that you felt that this discussion was helpful today, because this is a whole new frontier. And I definitely want to be open-minded and seek ways that I can utilize AI to be helpful to my clients in certain angles, in certain information that can be helpful, while simultaneously there are some fundamental aspects of a trained professional, I would say in the mental health field, in the medical field, that invoke nuances that are still not accessed through artificial intelligence. So thanks so much for tuning in to my Thrive YouTube channel today. And I hope this discussion was helpful for you. And I wish you the best in your mental health and also in the ways that you're trying to navigate the journey to both understand and to appropriately utilize AI in your life and in your pursuits. So wishing you the best, and thanks again.